Thank you, Dr. Meghna, and I'm thankful to the organizing team for giving me this opportunity to present a paper, life course approach for prevention of non-communicable disease. So I'll make the environment a little lighter because every one of us has to play a role, be it a pediatrician, be it a gynecologist or general physician. Everyone has a role, and everyone can contribute in this approach. If we leave it to cardiologist or a general physician only, then it will be injustice to the patient. So every citizen, every physician, everyone has to be a part of this life course approach. So as we know that NCD account for now it is a major chunk of morbidity and mortality are due to non-communicable diseases, and the four most diseases which contribute more, like cardiovascular disease, are the major killers, followed by cancer, chronic respiratory disease and diabetes. So in addition to this cardiovascular disease, cancer, chronic respiratory disease and diabetes, we have other diseases like hypertension, dyslipidemia, obesity, metabolic syndrome. So the diseases are innumerable, but with every disease there is a role of lifestyle modification. So we will discuss that. You can see a lot of risk factors of non-communicable disease. Some are modifiable, some are non-modifiable. So modifiable risk factors, these are spread across right from the conception till geriatric age. So like tobacco use, alcohol use, physical activity, weight, dietary practices, dental health care, and managing various diseases. So air pollution and many other factors are there which can be easily managed at various stages of life. So for these major diseases like cardiovascular disease, diabetes, cancer and chronic respiratory diseases, these tobacco, unhealthy diet, physical inactivity and harmful use of alcohol play a major role. While for other diseases like mental health and cardiovascular morbidities, other factors also play a role. So now NCD affects all countries and people of all ages. So it is now considered as world's biggest killer. And if we follow the life course approach, then right from the preconception through pregnancy, then infancy, early years, childhood, adolescence, teenage years and adulthood, and then to the geriatric age group. So everyone is involved, and these factors go on accumulating from pregnancy or from the antenatal period. So a life course approach of NCD involves maximizing people's health or well-being throughout their lifespan. So we have to have a holistic approach for prevention of this disease. Like social, we have to have a control over the social environment, environmental control, and economic and lifestyle determinants are very important for control of this non-communicable disease burden. So if we see the global burden of disease in 90s and in say 2023, so it is drastically changed, and we have a double, or in fact we have triple burden of disease now. So we'll see that the NCD burden is increasing, both morbidity and mortality are increasing. This is basically due to the exposure to unhealthy lifestyle and lack of physical exercise or adoption of sedentary lifestyle. So this epidemiological transition and increase in the life expectancy. So it is manifested after say 50s, but these factors or the risk factors increase right from the childhood age. So there is a need for stronger health system and health worker integration. So every physician, every health authority, health administration, everyone has to play a big role in making this health system stronger. So it needs more resource allocation, better preventive knowledge and awareness of danger sign. Earlier diagnosis and treatment is required. So many non-government organizations like World Health Organization, UN agencies, they are playing a big role in controlling it in developing countries also. So nutrition play a very big role across all the life stages, and we'll discuss it in detail. In childhood, a new risk of NCD may appear due to easy access to unhealthy foods and drinks in their canteens. So now Eat Right Campus concept is there. So we can inculcate a healthy lifestyle right from the school age. So Eat Right Campus need is there, so that in childhood they get the option of choosing the right kind of food. In young people, in adolescents, adolescent people acquire the harmful habits such as smoking and drinking alcohol, which are the major contributors of NCD, and this trend continues even in adulthood. And in addition to this, many other factors adds up, stress at the workplace, financial stressors, unemployment, unsatisfying career, low social engagement. So all these also contribute in adding the risk factors for non-communicable disease. Then retirement or in the geriatric period also, there are many stressors like poor nutrition, lack of physical activity, alcohol, tobacco, social isolation also plays a very big role. Financial stress directly affect the older people. So you can see that it affects all the ages. And maternal diet, lifestyle and body composition during the antenatal period plays a very important role, and which influence the children's development and body composition, and it can be diagnosed through ultrasound and genetic metabolic test. And lot of research is still needed to control these factors during this period. Now the aim is to control, to have a mechanism to uncover the developmental origin of NCD. So Dr. Barker has showed a significant role of maternal nutrition, which plays a significant role in adult disease, and he has found that adapting human fetuses to a limited supply of nutrient resulting permanent structure and metabolic changes. So malnutrition during the early period, it increases the chances of non-communicable disease in later life, and many cardiovascular complications are possible if one is having a low birth weight child, or if the malnutrition is there in early childhood. So importance of first 1000 days, the nutrition and the child development during first 1000 days of life is very important, and if we can ensure a good development during this period, then we can decrease the chances of non-communicable diseases. So undernutrition during this period increases chances of heart disease, diabetes, hypertension in later life. And moreover, unborn babies are not only negatively influenced by maternal habit, like diet during the antenatal period, what drugs mother is taking, any alcohol or tobacco consumption during pregnancy, or other environmental factors like now air pollution is also a big factor in non-communicable disease. So a low birth weight is attributable to poor long-term health and poor cognition. So NCD risk factor during the life course, that is infancy, childhood, adolescence and adulthood, contribute to prenatal maternal undernutrition and low birth weight, and this is how we increases the chances of later complication in the form of non-communicable disease. So across various life stages you can see different factors which play a role, and this is how the risk factor go on accumulating, and it usually manifests after 50s, but now we can see because it is a multifactorial causation disease, so it manifests even earlier in present scenario. So somehow at least we can play a big role in controlling the modifiable factors. So you can see the different curves. The upper curve, if we do not intervene anywhere and if we continue to follow the unhealthy lifestyle, or if we continue to follow all the risk factors, then the upper curve will be there. And if we follow all the means if we follow the better lifestyle, then the lower one is by early intervention we can largely reduce the burden of non-communicable disease. In this graph there is a role of physician also. Suppose if mother is entering if without planning, if mother is going to antenatal period, then there is a high risk of preconception period, and without any reducing any risk factor, there is a increased chances of risk of NCD in mother as well as in child, because of if the weight gain is more, then there are chances of hypertension or diabetes. So it will increase the risk for both mother as well as for child. So barriers at healthcare professional level are like sometimes due to heavy OPD we do not give enough time for the counseling. So due to time constraints, due to lack of awareness and resources, sometimes due to hesitance about the intervention effectiveness, we ignore many factors. So and due to these barriers, there is a continued barrier for healthcare professional to communicate or intervene to their patients, and inadequate or no follow-up of high-risk pregnancies and babies. This is how, due to our ignorance and due to the ignorance at the patient level, the chances continue to be high. Now coming to the last stage, that is 2021 to 2030 is declared as a decade of healthy aging by Ministry of Health and Family Welfare. So our health minister at that time, he has launched a decade of healthy aging. So the aim is to a decade of concerted action by countries across the globe to ensure the healthy life for a rapidly growing elderly population. So in this you can see that in next India's 50% population is increasing from 270 million to 410 million in next 15 years. So this increase in the geriatric age will be rapid, because of increasing life expectancy and decrease in the younger population. So at present we have around 125 million 50 to 60 year population, and over 60 year population is 135 million, and by 2036 we will have 400 million of this geriatric population. So every fourth person will be 50 plus in next 15 years. So this comorbid condition predisposes the population to vaccine preventable diseases, and you see that around 18% population is increasing between the 50 to 54 years to 60 to 64 years. So almost every second person above 50 has at least one comorbid condition. And there is a need of giving the influenza vaccination to decrease the chances due to these morbidities. So incidence rate ratio of influenza related hospitalization for adult with comorbidities are increasing, and in end stage renal disease the incidence rate ratio due to influenza due to hospitalization is very high. Similarly for COPD, CHF and asthma it is high. So for particularly these patients it is recommended to give influenza vaccine to people over 50 years of age. Incidence of invasive pneumococcal disease is also high. If a person is healthy, then there are chances of only 4.5%, while a person with a comorbidities, the chances increase to 167%. So it is recommended to give pneumococcal vaccine also to people over 50 years of age. Similarly, in this we see the predisposition which lead to sharp rise in the incidence and severity of vaccine preventable disease, and incidence of invasive pneumococcal disease per lakh population is presented here. So in 50s, if between 50s to 65 plus, there are 65% increase in the incidence of invasive pneumococcal disease. So as person move to the geriatric age group, the lung chances of lung disease increase. So again it emphasizes the need for pneumococcal immunization. So nowadays adult immunization is also important. So incidence of herpes zoster is also more over 60-year population. Influenza related hospitalization is also increased manifold from 50s to 60s. So there is a significant hospitalization episode after 60s. So from 45 to 60 years and from 60 to 69 there are 71% increase in hospitalization. So this is the medical bodies have recommended usage of these vaccine over 50 years of age. So it is recommended that over 50 years of age, all the important medical societies like Geriatric Society of India, Association of Physicians of India, IMA, Indian Association of Occupational Health, all have recommended the use of influenza, pneumococcal vaccine, herpes zoster, Tdap, MMR in the adult population. So what are the factors to promote the adult immunization? We can promote adult immunization by increasing the physician's awareness and knowledge, by removing the vaccine apathy, because it is instilled in our mind that vaccine is for childhood age. But now this due to COVID, this barrier is now removed and we can realize the importance of vaccination in adulthood also. So somehow government has to provide some sponsorship or some hand holding for removing the socio-demographic barriers, and we have to modify the behavior and lifestyle factors in addition to it, improving the channels of access, that is these adulthood immunization should be made available in many centers across India, and we are happy that we are providing adulthood immunization in our AIIMS. So you can refer patients from other areas of Punjab or nearby state to us. So overall we have to focus in 7 focal areas, that is we have to improve the mental health, we have to focus more on reduction of non-communicable disease, we have to give more elderly care, we have to make geriatric friendly hospitals because this population is increasing and the morbidity is also on rise. We have to give adequate nutrition, balanced kind of nutrition across all ages, not only in adult but right from the pregnancy. So we have to give more focus on a holistic health and traditional medicine also. So now the concept of One Health is also on rise, that is humans, animals and environment are studied together. So thank you.